Mike Gibson, Barry Borlaug coming to you live from ACC 2023, and we're talking about the CAMEO-DAPA study. Obviously, Barry was seeing a lot of benefits with DAPA, but we really want to understand the mechanism. And what I was excited by was you did some hemodynamic measures to help us understand how it works. So what do you find?
Well, HFpEF is due to many things, but abnormal hemodynamics, high filling pressures, high LV filling pressures at rest, and especially during exercise, are really sort of fundamental. And we know that SGLT2 inhibitors like Dapagliflozin improve heart outcomes, they improve quality of life, but no one really understands why, as you mentioned. So here we hypothesize that treatment with Dapagliflozin would favorably reduce pulmonary wedge pressure at rest and during exercise in patients with HFpEF. So we carried out this randomized double-blind placebo-controlled trial where we treated patients with HFpEF in class 2 to 3 heart failure with Dapagliflozin 10 milligrams once daily or placebo for 24 weeks. And we did an invasive hemodynamic exercise test using high fidelity solid state micromanometer catheters to measure pulmonary vascular and pulmonary wedge pressures at rest and during exercise prior to treatment and after 6 months of treatment with DAPA or placebo. And we observed that there were significant reductions in both resting and exercise wedge pressure as compared to placebo in people treated with Dapagliflozin. We also saw favorable overall effects on right atrial pressure, incorporating both rest and exercise, and pulmonary artery pressures. We saw a reduction in body weight and a reduction in plasma volume, which we also directly measured using a radiolabeled indicator dilution technique. And we saw that the reductions in wedge pressure were actually correlated with the reductions in body weight, which was interesting. So we think that this sheds some new light on the mechanism of benefit with SGLT2 inhibitors in HFpEF.
Amazing. My old mentor and boss, William Grossman, he was, really all about hemodynamics, and we really had a very good hemodynamic lab. And, one of the ways you write a lot of great papers is just doing these before and after interventions and looking at hemodynamics. I'm kind of dumbfounded we hadn't had more of this information before. But this is, very consistent, or some surprises there, I guess I would have said. But thank you, Barry, for doing such a very careful study. This is kind of work we need to really understand the mechanism of these drugs. The clinical benefits are great, but it's always great when you put the story together and give people, a reason to believe there's a why there. So great work, Barry. Fascinating stuff. Thanks for joining us. Thanks for sharing. And thanks for everyone here live from ACC 2023.
Thank you.